Because operation jenna आम्ही answer केला 66 posts were sanctioned, out of which 23 are vacant. And 14 are on contract. So basically, if you look, that's more than 55% of the staff are either missing or temporary arrangement in this particular thing. And that's because inga answer in next crucial field level positions like multi-purpose health workers, they are the backbone today of the outreach. Now 5 male and 4 female are vacant. MTS are lying vacant. Even basic data management and immunization support roles, staff is lying vacant. Now, if you look, because given this large number of MTS vacancies, what is the specific time? It's already sanctioned. Now in this house when we come, it's because the sanction strength, what stops you from taking these people? Number two, it's because will you ensure, looking at the load that he said, will you ensure that some specialists from Opposition district hospital also visit this Cansaulim PHC on a regular rotational basis? I know there is a shortage in South Goa district, everywhere there is a shortage. But finally doctors are needed. What mechanism do you have in the future to make sure that PHC Padhai runs smoothly and the staff, contractual like a permanent, when will this be done?
Speaker sir, the contractual and permanent जे उलेला honorable leader of opposition are पहिले म्हणजे जे hospital ज्यांना conceptualize केले and before what Mr. Honorable MLA Cansaulim is saying, Anton was, is that at that point of time when you make a hospital, at that is a time when you have to actually factor in the number of staff, what is the activity, what is the area that is going to cater to. All these things should be a comprehensive study. And this has to go hand in hand. That's what we had a discussion with Honorable MLA Jeet Arolkar, that it is important for us to deliver a loaded hospital to the people. Once you build a hospital and then you start finding out actually what are the lacunae and where is the shortfall, then everything you have to again start putting everything together. When that hospital was built, never there was any process carried out for the number of staff that is required and what actually are the specialties that are going to come to that hospital. Actually, now I am coming forward. We have discussed with the Honorable Chief Minister is that we want to take a comprehensive Government of India organization on board to deal with a hub and spoke model so that these diagnostics and other things, so all these shortfalls that are there get completed, and this is the system that is being followed by Government of India. It becomes easy for us to deal with, so then there is a transparency in the process. Now what Honorable I am coming to that only. What he is saying, he has not mentioned. Actually, the ultrasound machine in that particular area, तुझ्याच hospital ultrasound machine जे आहे ते चलाना. काल डायरेक्टरान सांगला ऑलरेडी नोट बीट धाडून दिल्ली आसा की ह्यो सगळे गोष्टी जे शॉर्टफॉल जे आसा ते तुझेकडे बस. आम्ही जिताचे केला, बाब सुभाष फळदेसायचे केला, तसेच आम्ही 2-3 कुर्चोनेचे ऑलरेडी आम्ही मॅपिंग करपाक लायल्या. साऊथ गोवा डिस्ट्रिक्ट हॉस्पिटलाचे पयर विजयन कितें सजेशन्स केल्ले, युरीन पयर ऑनरेबल लिडर ऑपोजिशनान केल्ले, आमच्या सायडींतल्यान आमचे सगळे आमदारान केल्ले, they map kurun so that when we send the proposal back, including Cansaulim, I told them to integrate, is what is required. I will make sure that this proposal is sent by the PhD to the personnel department to see that this is completed at the earliest. I don't do the recruitment. And as far as I am concerned, I will talk to Honorable Chief Minister. We will do it on a fast track. But apart from that, we need to reassess what are the gaps as far as Cansaulim primary health center is concerned, because the building is huge. Every day about 100-125 people come there to the OPD. But overall, if you look at it, that needs to be upgraded based on what is the requirement of that area. I have already started the process finding out what are the gaps so that I can put a comprehensive proposal pertaining to these hospitals to the PhD and then send it to the finance and ARD and personnel accordingly to make a fresh assessment of what is required.
Speaker sir, एक मंत्री गांव सांगपाक सोदता, you made the same statement last year about the shortage.
No,
you said that you would speak to Chief Minister. Only
I'll just tell you add on. Speaker sir, कितें हे hospital जेन्ना आमी बांदता, हे हॉस्पिटल बांदता तेन्ना आमकां ते असेसमेंट करपाची गरज आसा की हांगा अल्ट्रासाउंड आसतले, हांगा सिटी स्कॅन आसतले, हांगा कितें कितें स्पेशलिटीज जाय ते स्पेशली नसतना आमी जेन्ना वचून आमी ते हॉस्पिटल जर आमी जर इनॉग्रेट केले तर कितें जाता की परत ना हांवूच आशिल्लो ते वेगळे गोश्ट पण बांदले म्हाजे पयलीं. पण मेन म्हणजे कितें आहा ते आतां कोणाक सांगून की कोणी बांदले, दॅट्स नॉट द पॉयंट. माय जॉब इज टू सी दॅट वॉट युअर
Minister, you are saying that there was no staff, sanctioned staff for so many years from the time it's implemented.
Okay,
you need to give a clear answer. When will you shortage of staff?
There is a shortage.
And doctor doctor from hospice, whether you planned for any emergency 24/7 thing.
Atas-
Thenga je
on-
machine
on-
are sonography je te
yes,
solna.
yes.
Give a proper answer. When will you do it?
आताच कॉन्ट्रॅक्च्युअल बेसिसाचेर आम्ही इनिशिएट केल्या टू टेक स्पेशलिस्ट ऑन बोर्ड. यू मस्ट हॅव सीन द एडवर्टाइजमेंट. वी हॅव टेकिंग मोर देन 200 पीपल ऑन बोर्ड.
No, with that your advertisement I've seen, but all are going to
Response has been good. So we will place wherever there is a shortfall, we'll use this staff to place it there.
Response is good because Director of Health Services has increased the
Srivanti
payments.
Vegas.
एक point rata sir. DHS has increased the salary of the doctors, whereas GMC the salaries are less. You are giving 1.5-2 lakhs for DHS.
We are doing that parity. What
No,
was
but now it's not there. So solely GMC doctor buying etle.
No, तशें-
Check for sarke balance sarjawpa जाय.